Hi, Miss Baker. Nice to meet you. My name is Nick, and I'm a pharmacy intern on the general medicine team. Now that you are being sent home from the hospital, I was planning on taking a few minutes to provide some additional counseling on your medical conditions and how best to manage them. Is that okay? Okay, great. So I see here a list of medications you're currently taking, as well as the new cholesterol medication that was prescribed to you. And I'd be more than happy to answer any questions related to those, but I first want to talk to you about specific non-medication counseling points and things that you can do every day to prevent lupus flares and successfully manage your disease. So to prevent lupus flare-ups, it's crucial that we keep your other medical conditions under control, including your blood pressure and cholesterol. If these levels are uncontrolled, it can increase your risk of atherosclerosis, which is a fancy way of saying a buildup of plaque in your arteries. Because this can increase your likelihood of having a heart attack or stroke, I really want to stress the importance of diet and physical exercise. Two very well-studied diets that are associated with a significantly lower risk of heart and metabolic diseases are the DASH diet and the Mediterranean diet. So the DASH diet is all about choosing foods that are low in salt content in hopes of decreasing sodium intake to less than 2.3 grams per day and ultimately lowering blood pressure. I highly recommend reading food labels carefully for sodium content, straying away from processed foods or fast foods, and leaning more towards fresh fruits, vegetables, and white meats as opposed to red meats. In addition, the DASH diet stresses decreased caffeine intake to only 1 cup of coffee per day and decreased alcohol intake to 1 drink per day. The Mediterranean diet, in addition to stressing the importance of fruits and vegetables, also recommends the consumption of fish, legumes, nuts, and unsaturated fatty acids like olive oil. In addition to diet, I wanted to quickly touch on exercise. If you don't do so already, I want to recommend involving yourself with 90 to 150 minutes of aerobic exercise per week, which is really only 30-minute periods of time for 3 to 5 days per week. So some examples of aerobic exercise can include simply walking or running, various cardio machines at the gym, swimming, hiking, dancing, kickboxing, or all of the above. Exercise has been shown to decrease patients' risk for cardiovascular events, overall fatigue, and osteoporosis, or bone weakening, both of which are potential side effects of lupus. Fatigue and depression have also been improved following exercise-based interventions in patients with SLE. Being that photosensitivity is a very common side effect, sunscreen and/or protective clothing is highly recommended in patients who have lupus because the sunlight can cause intense rashes that can reside in the facial region near the nose and cheeks, as well as any other parts of your body that were directly in contact with the sunlight. Because of all the dermatologic side effects, I'm thinking that a good option might be to get into the habit of using Cetaphil Daily Facial Moisturizer. It's super hydrating and actually comes with SPF 15 or SPF 50 to protect you from the sun, and also make sure to stay away from any UV light such as tanning salons, because even though it's not the actual sun, it's still harmful for your skin and can result in those skin rashes that I was talking about. Lastly, cigarette smoking is highly discouraged as it can exacerbate SLE and decrease the effectiveness of the hydroxychloroquine that you're taking to manage the lupus. I have here that you don't smoke, but I just wanted to encourage that behavior and let you know that if you were thinking about picking up the habit for whatever reason, now is definitely not the time to start. So I'm here if you have any other questions right now, or if you have any questions in the future about any of this information, feel free to give us a call at the hospital pharmacy phone line at 617-555-4321. Thank you.